welcome back to another segment of Fear LA Presents Up in the Rafters right here on CRN Talk. And it is my pleasure, because Mark is not here with me today, but I know this guy's a talker. So I know this guy he's been in radio. He has a Weekend Warrior show called The Weekend Warrior on ESPN LA 710 every Saturday from 7 to 9. He's an orthopedic surgeon, ESPN radio host, Fox Sports 1 TV analyst, and a marble sculptor, and a surfer, and an author. And he has so many other things that you could follow on his Twitter at Dr. Robert Klapper. It is none other than Dr. Robert Klapper.
Oh, listen to you, Zach. I love it.
How are you doing, Doc? How's everything in the surgeon's room today?
Today was good. Today I'm preparing for some time off because of Thanksgiving, so I got to do some exercise tomorrow, wake up early, and be in the ocean surfing. So it's all good to take some time off.
Before we get to the Laker injuries, I just want to say I really like your whole approach, because I've been listening to you obviously for the last several months, and I really do like the fact that you're trying to take the holistic route when it comes to some of the people who call into your show when it comes to their injuries. What would you say made you want to go the holistic route?
Well, that's a really good question. I think to some extent, deep down, there's a spiritual aspect to who I am. And I am so lucky to be a doctor, to work on a piece of machinery that whether you believe in God or not, something else made. It's not like an engine where page 27 are the pistons and the cylinders, and if this is cracked, you fix it. There's no owner's manual to the body. And to be able to learn how it works. I've been an orthopedic surgeon at Cedars for 32 years, see 100 patients a week for 32 years, done over 16,000 surgeries. So I really feel an intimacy with how our body works. And on the one hand, you can't figure it out. But on the other hand, I get to fix things that are broken, which is kind of fun as an orthopedic surgeon. So when I can let the body do its healing, I prefer that. I'm the only surgeon who gets excited if you don't need surgery, because trust me, you eventually will. You know, the joints will wear out. You tear your ACL. There's stuff that just won't heal on its own, and then it's fun to be a surgeon. But for the most part, you really should appreciate the holistic approach and not let anybody talk you into needles of cortisone and stem cells and PRP. It's a business medicine, and I see it as a higher art form than just a business.
Yep, and I know he's not really a Laker, and I know this wasn't the players that I told you that we were going to talk about, but last year I worked with the Clippers radio network, and I remember Kawhi Leonard was somebody that was trying to pretend no, I don't need ACL surgery, I don't need it, and eventually enough he sat out the rest of the playoffs, and he did get it back in July. Do you think by him waiting that long to have an ACL surgery that it kind of thwarted his return time?
Well, now you're getting into a very interesting aspect of being a surgeon, an orthopedic surgeon, because, Zach, what is often not appreciated in the medical world and in the lay people world is beyond the physical injury. So, for example, Derrick Rose. Everybody criticized him because he took a year and a half to come back after his ACL. At the same time, we had Adrian Peterson, who didn't wait 9 months, but I think 8 months after his ACL reconstruction, was back on the field and almost broke Eric Dickerson's record.
Yeah.
So he was criticized. Hey, why are you taking twice as long to come back versus Adrian Peterson? And here's a big part of what I want your listeners to appreciate, and that is, how did the injury occur? When Paul George went flying into the backboard stanchion, remember that, and snapped his tibia?
Yeah.
Or Adrian Peterson was tackled by someone and tore his ACL, that's different than when you plant your foot, Derrick Rose, no one touched you, and you have a non-contact reason for tearing your anterior cruciate ligament. So the mechanism of injury, if it's with contact or no contact, is a different story. When you tear your Achilles tendon and nobody's touched you, an elite athlete starts to say, uh-oh, is my body breaking down? Can I not count on my body? Is it over? Versus when there is a reason it tore, that there's contact. I believe an athlete has an advantage if it was due to a collision. If it was due to a violent act, and these sports can be violent. Football is the greatest example, but basketball can be the same way. When you are collided with someone and that's the reason you are injured, I think psychologically you can bounce back better. So you really have to look at it. So my wife always says I never answer the question, so I'm going to answer the question. Kawhi Leonard. Look back in his history. He feels, whether right or wrong, but he feels that in San Antonio, his quadricep injury was not taken seriously by the team. Now, they can argue, no, we take care of all of our players. We care about our players. Well, that doesn't matter if the player felt I was ignored, and the way he felt that his injury wasn't taken seriously, got his own doctor, his own trainers, and ultimately led to his release. He didn't want to be a Spur anymore and went to Toronto. He was that upset about it. So let's think about Kawhi's psychological aspect of, hey, I'm a good healer. I know my body, and I have a distrust for the doctors, and I don't blame him. We can't blame him because you and I have to walk a mile in his shoes before we can sit on the sideline and judge the way he feels about his injury.
And to go off your topic of how you were just saying the contact versus no contact, LeBron had a strain that happened earlier this season where it was kind of a no contact play. And while a lot of people were saying, well, like, oh, we'll just give him out at least a week, you were somebody that rose a question mark to a lot of Twitter people out there where it's just like, wait, this could be a lot more serious. Now that LeBron has come back, suspension aside, do you think LeBron is back to being 100%, or is there something underlining that?
Well, you now bring up the point. He's an older player, LeBron James. He's physically built like nobody we've ever seen before. But guess what? Father Time is undefeated. So if no one really hit him, remember his ankle injury, someone fell on his ankle. That was traumatic. That's a difficult injury to come back from. But again, it's due to a collision. If you now tear and strain, which is a microscopic tear, your abdominal muscle, you now say to yourself, uh-oh, am I starting to break down? And here's the key that your listeners have to appreciate. In a young player, you get a hamstring strain, you'll bounce back and you come back right away. But if you get the same hamstring strain or abdominal strain and you're a veteran player, you have to let it be 100% before you come back, because I can promise you this. You will now overcompensate and tear something else. So his reluctance to come back right away, his taking his sweet time, he knows his body better than anybody else, but he is a veteran player now with an injury that happened without a collision. Look out. You better really take good care of yourself because something else could happen.
And I know LeBron's whole stance when it comes to, we don't really do load management. That's not the Lakers. Do you think that would actually be a smart thing, considering that Anthony Davis has an injury-prone history, that this is actually one of the oldest teams in the NBA, and knowing LeBron's condition, do you think the Lakers should try to integrate more load management?
Well, that's another interesting point. I don't know if load management is a great idea. The body actually, you watch all those players on the sidelines, they're riding a stationary bike when you watch football games and some basketball games. You really can tighten up if you're not actually continuing to move. So there's a problem with taking too much time off. Some of these teams, they go riding into the playoffs, and that gives them a bye, and that gives them time off, and then we watch them enter the playoffs, and they immediately lose in the first round, whether it's football or baseball or hockey or whatever it is. There's a rust that starts to take place, rest versus rust. And so no one really knows the answer that load management is good or not for a player, and that includes veteran players. It's an unproven quality. Now, I will say this. You have to actually look at the length of LeBron's career and appreciate when does he turn it on. Maybe he doesn't play defense like he used to when he was a rookie. So that's his internal way of doing load management versus physically being Greg Popovich, hey, we're going into a new city, you're not playing tonight, you need to rest. So you can actually do load management in a quiet way. Maybe you don't play defense as intensely during the regular season games, and then you flip the switch and turn it on for the playoffs.
Yep, that's a good point. We're on the phone right now with the orthopedic surgeon from Cedars-Sinai, Dr. Robert Klapper. You can listen to him every Saturday from 7 a.m. and 9 a.m. on ESPN 710. So now on to the young guys for the Lakers. Kendrick Nunn. Kendrick Nunn has had a bone bruise, and he has not played one game this season so far. Is that alarming for someone that young to have not come back into the season so far?
Not at all. And I tell you, this is the beauty of the modern technology we have, because we have x-rays. Mm-hmm. Bone has calcium, your ligaments, your meniscus, the cartilage is invisible on an x-ray. So we only can tell you what's going on with the bone. However, due to modern technology and the sensitivity of the MRI, we can now actually see your ligament, the cartilage, the soft tissues, and now for the first time, we can actually see if there's a bruise in the bone. What's a bruise in the bone? Here's a Klapper vision for you, so that you can actually visualize what I'm talking about. If you get smacked in the arm, you get a black and blue mark in your arm, in the skin, in the muscle. You know how it goes. That black and blue mark is sore. You don't want a massage. You don't want anybody touching you. Leave me alone. You can put ice on it, or just leave it alone. It'll turn green, it'll turn yellow, and goes away 4 weeks, 6 weeks, and it's gone. Because it can dissipate the black and blue, the bleeding that occurred, the contusion into the muscles and soft tissues of the skin and the subcutaneous tissues. It dissipates because it's in soft tissue. But if you sprain your ankle or you get whacked in the knee, x-rays are negative. You now do an MRI, guess what? We can now see if there's bruising in the bone, a black and blue mark inside the bone. We have fancy words for it. Trabecular microfracture. It can get really scary with the words we use. Trust me, it's a black and blue mark. Everybody has to calm down. It's not a fracture. But because it's in bone, which is a solid structure, it's not skin and muscle and subcutaneous tissues where the bleeding can dissipate. No, it's locked in the bone itself. They take time to dissipate. And I got news for you. If you have a bone bruise, we can actually see the black and blue mark, the contusion, for over a year still in the bone. Can you imagine? That's how long these things can do. And I'm not saying he's going to stay out for that long, but this is why you'll hear sometimes where someone sprains their knee or sprains their ankle, and if it's just the ligament, yeah, you can be back 3 weeks, 6 weeks, no big deal. But if the MRI tells us that in addition to the ligament damage, you also have a bone bruise, buckle your seatbelt. This injury is going to be exquisitely painful, and this player will not be coming back for at least a couple of months.
Now, Doc, I'm going to be honest. I asked you a selfish question earlier. One of the first times I met you, and it's because around the first time that I met you, it was when Chris Paul was in the playoffs and he hurt his hamstring, and that seems to be a continued story. But comparing that to Austin Reeves, who's the Lakers rookie, he also has a hamstring injury. Now, I am somewhere in the middle of their ages. I mean, what can I expect with a hamstring injury over time compared to those ages?
Well, first you have to understand what exactly is the hamstring. It's a fascinating muscle, and I can talk for hours about this muscle. But if you're sitting now listening to this radio show, which I'm hopeful everyone does, you take your hand and feel the back of your thigh. Feel where your butt is and feel the back of your knee as you're sitting down. Now, if you and I were to design a body, we would make the muscles, the cables that go from your pelvis, your butt, go straight down to the back of your knee so that when they contract, they flex your knee and extend your hip. That's how you and I would design the body. But as I said before, when you asked me why am I holistic and why do I try to avoid surgery with it being holistic, no shots and pills, is because the body still to this day amazes me. Because if I peel away the skin in the back of your thigh, guess what we're going to see? We're going to see muscles that actually diagonally cross the back of your thigh. They go from the outside of your pelvis and go to the big toe side of your knee along the back. The hamstring, the biceps femoris muscle, is a diagonal muscle. Now, why the hell would we be designed with a diagonal muscle?
That's a great question, Doc. Do you mind if we actually continue this to the next segment? Can you stay for one more segment?
Of course.
Okay, we got Dr. Robert Klapper on the phone with us, so don't go anywhere. We'll be right back here on Fairley Presents Up with the Rafters on CRN Talk. And welcome back to the final segment of Fairley Presents Up with the Rafters here on CRN Talk. Those are the horns. We want to thank Mike Horn, Jennifer Horn for letting us use this magical studio somewhere deep in the valley. Mark Gonzales is not here tonight. He is taking a break. He needs it because he got a new job. He's the general manager of a dispensary. And before we go back onto our guest, Dr. Robert Klapper, I know we were talking about hamstrings, but just real quick, with everything that's happening with marijuana, I am not someone that uses marijuana, but I do believe that CBD can be something that is beneficial to many people. Have you seen anything, like where is your stance when it comes to medicinal use and healing the body?
We use marijuana in our cancer patients, and it's very effective. I'm not so sure the CBD ointment, there is an anti-inflammatory component, and I totally understand it, and I'm only going by feedback that I get from my patients who I see with musculoskeletal complaints. They tell me the CBT, they use it, but it's really not, that great. But I will tell you, marijuana gummy bears as a painkiller so that you don't have to take opiates or narcotics, I am all for it. Smoking it, not that I advocate you should smoke, certainly can be very effective as a painkiller. Again, it's very effective in cancer patients, and I do everything I can to avoid narcotics and opiates. I write books. I've written 3 books, Heal Your Hips, Heal Your Knees, all about pool exercises. I will do everything to try to stay away from, the traditional pain medications that are awful. But I'm a big advocate for using marijuana gummy bears for patients with pain, particularly after surgery. If they have a bad injury, I prefer it to all the usual suspects.
So, Mark, if you're listening, you're doing the Lord's work. Keep it up. Keep up the good work. But back to the hamstring again, because not only does it apply to a lot of Laker fans and their fan favorite Austin Reeves, but it also applies to me. So, as you were saying, why would the hamstring be vertical, right?
No, diagonal.
Diagonal, excuse me.
Diagonal?
Why is it diagonal?
Muscle. It starts from your ischial tuberosity, which is the bone that you're sitting on in your pelvis, and crosses, not comes straight down, but crosses the back of your thigh. Because, and here's a Klapper vision, if you have a string wrapped around a top, you pull on that string, because it's diagonally wrapping around the top, you pull on the string, and it spins. That's how you make a top spin. Those diagonal construct to the string, a twist top for a bottle of soda. That diagonal is so strong when you go diagonally. It's rotational, and that's the secret. You are asking your body to rotate. Well, when you injure your hamstring, that diagonal muscle, let me tell you something. It is a long time before it comes back. And yes, you can be young like Austin Reeves or young like Zac Elk and come back. But you better be 100% before you come back, because I got news for you. You will overcompensate and tear something else. And you always have to ask this one question. If you have an injury in the back of your thigh, you now also have to implicate your quadriceps muscle, which is in the front of the thigh. Because the way our body works, and we have a fancy word for muscles, agonists and antagonists. Mm-hmm. There's a yin and yang. So oftentimes you're injuring your hamstring because your quadricep is either going too strong and is not balanced. Here's another Klapper vision for you. Your muscles are like going to a park and watching kids on a seesaw. One goes up, the other goes down. That's how your muscles work.
And I'm glad you brought that up because, again, it's like not just the hamstring and the quads, but with Anthony Davis and a lot of the injuries that we saw last year, you brought it up that it's literally a chain of events. So it was not just a higher ankle injury that he had, but it also was something that was pertaining towards his Achilles, and that could have been scary. Then it went up to his knee. Yeah, his
remember,
hip.
he had his groin. It's called the kinetic chain. I didn't make it up, but I remember working with Coach Dave Miller in the beginning 10.5 years ago, the Weekend Warrior show. He taught me. It's all about, when you shoot the basketball, we all look at Steph Curry and how or Klay Thompson, how they snap their wrist and their follow-through. That's because we're rookies. Mm-hmm. We're looking at the ball in your wrist and your hand. But if you're Dave Miller and people who know basketball, you know what they're looking at? Their feet. They're looking at how the shot, the power of your shot, the accuracy of your shot comes from your legs. Yeah, the ball comes off your wrist and hand, but it actually comes off the tips of your toes and how you leap off the floor.
And when it comes to someone like Trevor Ariza, again, he kind of falls back into the category of like LeBron's age range. He had foot surgery, and his timeline is actually a lot more than Austin Reeves' return. So what should we expect with Trevor Ariza? Is there any type of worries that we should have as Laker fans?
Not a worry, but even Frank Vogel said he's not coming along that fast. Don't expect him back that quick. And it's been reported that he had an ankle arthroscopy and a debridement. What is a debridement? The fancy word for a cleanup. We use literally a vacuum cleaner that we stick in the joint, and we clean up a lot of the debris, the age-related stuff. Listen, he's been in the league for 17 years. He's 36 years old. But if you just clean up someone's ankle, you're not staying out for 2 months. So I suspect, and I didn't operate on him, so I'm not, I'm just going by what my gut feeling is that we oftentimes, in older patients, when we arthroscope them, we will see some early arthritis that can sometimes take place. And in addition to the debridement, we will do other things to the ankle that will delay the comeback. Sometimes, and I'm not saying this happened to Trevor Ariza, we'll do something, for example, called a microfracture. And so a Klapper vision is if you drive on Pacific Coast Highway and you go by Pepperdine, how beautiful that giant lawn is that you see. Well, trust me, if one of the sprinklers is broken, you will see a beautiful green lawn, and then you'll see a big brown spot around what you now know is a broken sprinkler. There's no water getting to that area of the grass. It dies. What do you do to fix that? Other than fixing the sprinkler, obviously. But they will do something called aerating the lawn. What do? They punch holes into the grass, into the dirt, so that seedlings deep down below can now rise to the top. They aerate the lawn. Well, in essence, when we look inside a joint where there's any kind of early cartilage damage, Amari Stoudemire had this. You'll hear about many players. They have a microfracture. We aerate the lawn. We literally drill holes hoping that cartilage cells can grow up through it. The problem is the new cartilage cells grow up is a reparative cartilage. God gives you only one set of adult teeth. You really get only one set of articular cartilage to coat the bone. So although you drill a hole in a microfracture and cartilage grows, it's not the good stuff. It's not really the articular cartilage that you get once in your life as you grow. So I suspect there was more going on for him to be out this long from just an ankle arthroscopy and debridement.
Now, going back real quick, you said cleaning up the ankle. What exactly does that mean? Like, what is in Trevor Ariza's ankle that needs to be cleaned?
Debridement means there's scar tissue, for want of a better term. There's excess, and it rubs, and it becomes swollen, and it can become painful, and every time you step on it. So that, again, I don't really have knowledge specifically, just the term ankle arthroscopy with debridement. But if he's going to be out for this long a period of time, and Frank Vogel says he's not even ready to come back yet, and he's been a player for a long time, I bet you there's a little bit more of an arthritic situation going on. And it's more than just a cleanup. It probably speaks to an arthritic condition that he has, which makes total sense.
So 2 more questions. One will be about LeBron, and the last one will be a humor one, okay? Because I know you love humor. But the next question about LeBron, do you think he will be able to beat Kareem Abdul-Jabbar's scoring record by the end of his career?
Wow. Putting me on the spot.
That's what we do here on Fear LA.
Probably. I think he's had the advantage of being able to, the Trailblazer has it the hardest. There was no one for Kareem to look at to score all those points. He had to really make it up on his own. And LeBron had the benefit of being able to sit back and calculate how he can achieve that goal. So if push comes to shove, I would say yes, he's going to surpass Kareem.
And then the last question, I know you're a huge comedy fan. I see it obviously in your show and your humor. What would you say are your biggest inspirations for your humor?
Well, my dad was a carpenter. My mom was a nurse. I grew up in a neighborhood that we almost didn't even belong to be in because money was a big problem. So I knew I wanted to get out of that neighborhood, and the only way I could get out of that neighborhood, Far Rockaway, New York, was going to school. So, but to go to school was expensive, and I wanted to go to the best school I could, and I ended up going to Columbia, which is a great school to go to, but they didn't give full scholarships and whatnot when I was going, so I knew I had to make money. And so where could I make the most amount of money? On vacations, even during the year, in addition to summer vacations. I worked as a busboy, a waiter in the Catskill Mountains in upstate New York. And even when I was 16, you're only supposed to get the job when you were 17. That's a whole other story. But I used to work in the nightclubs at night and during the day at meals. And I would work in the nightclub delivering drinks as a waiter to all the tables, and I would listen to the comedians. And I became so fascinated because I would learn their routine. And what I realized was I knew their whole routine. But the problem was each weekend was a different clientele. In other words, one weekend it was the school teachers union. The next weekend it was the plumbers union. The next weekend it was taxi drivers. So I knew the comedians' routines, and I would, as I'm delivering drinks, I would listen. And they would throw out a political joke to the school teachers. They would laugh. They would throw out a religious joke. Nobody laughed. They would throw out a sex joke. Taxi drivers roared with laughter. So I listened to how they could go fishing to see what crowd they have, and then they could steer their routine. And it was amazing to me how you can use comedy to teach and to manipulate someone. And I use it as a surgeon. I will tell patients, hey, I learned something from my father, the carpenter, to measure twice, cut once. And they start laughing. And I use humor in my daily life as a doctor and as a surgeon in a medicinal way. And I think it's the most powerful. If I can make you laugh in pre-op, before I'm about to do your hip replacement, knee replacement, shoulder, whatever surgery I'm going to do, and I'm a busy surgeon, but if beforehand in pre-op, when I'm saying hi to you, I can say, is your wife here or is she shopping at the Beverly Center? This could be a very expensive operation for you. And they laugh. Or I remind them that my father was a carpenter, measure twice, and they laugh. If you're coming into surgery now after I've just made you laugh, I don't care what drug the anesthesiologist has given you, I have helped you.
Thank you so much. And not only are you making them laugh, you're also inspiring them by doing the Weekend Warriors show. I mean, the type of people of influence that you share every week as an example, and comparing the arts and the sports world to what you encounter every day in the surgeon world, it is really outstanding for the listeners to hear. So thank you again. Everybody, listen to Weekend Warrior every Saturday from 7 a.m. to 9 a.m. on ESPN 710. And thank you, Dr. Robert Klapper, for joining us here on Fear LA tonight.
Zach, I'm proud of you, and it's an honor to be here with you, and Mike Horn is the greatest, and he's lucky to have you there in his studio. And thanks again for having me come on.
Thank you so much. Have a great night.
Okay, you too. Bye.
Go ahead and follow him on Twitter at Dr. Robert Klapper. That was none other than Dr. Robert Klapper joining us here on Fear LA Presents. And yeah, we talked a lot about injuries pertaining towards the Lakers, and while I was sharing that name, I was like, that's more names that I would like to mention for any other NBA team. It's just LeBron is kind of worried because he's old, but it's not even just the old guys. It's the young guys. Kendrick Nunn. I haven't seen Kendrick Nunn play, and he was somebody that was so excited to watch coming up this season, and he hasn't gotten to play. Austin Reeves is a brand new rookie, has a hamstring injury, which if you know Christian McCaffrey from the Carolina Panthers, he was like missing a lot of weeks. So it's kind of scary that whether or not this is the Lakers' year, that's one thing to be determined. I just think the injuries aside is also what's tackling the Lakers at this moment. Because how can you build chemistry if nobody's really there? How can you build, it would be nice for LeBron to gel with Anthony Davis and Russell Westbrook, but who's to say with Anthony Davis's injury-prone history that once LeBron comes back off of the suspension after he had his own miss half the season because of his own personal injury, when he comes back, who's to say that Anthony Davis doesn't go down? Or remember, Russell Westbrook actually has been out for a whole season before. Remember the Patrick Beverley dirty trick thing back between it was the Houston Rockets and Oklahoma City? So it's just scary to know that the Lakers have this uphill battle to go to going on with the rest of the season, because it's not them learning about the chemistry and how to gel together. It's about putting the pieces out in front of them. So we'll see how this goes. I'm still going to stay optimistic. As long as Brian Windhorst is optimistic, then so am I. Well, he's not necessarily optimistic, but he's saying, he's giving it till January. And we should give it till January. Fair enough. We should wait. But as long as we're doing this week by week, right now, it doesn't look too good, because the Lakers are about 500. I didn't check the Knicks score yet, but we should find out what the Lakers are going to do by the end of this month, and we should have a better idea of what their identity is. So for Mark Gonzales, I've been Zac Elk. Thank you, Mike Gary, for holding down the fort in the first segment. This has been another edition of Fear LA Presents Up at the Rafters right here on CRN Talk. We'll see you next week.